This is Dr. Sunil Tumala. I'm going to talk today about the technology of yoga for physical and emotional well-being. I'm a board certified neurologist in Frisco, Texas, and I'm a practitioner of yoga myself. Yoga as a technology has been in practice in ancient India for thousands of years. It has come to the West only in the last few decades. However, it has spread significantly all over the West as everybody saw the unique benefits of yoga, which cannot be matched by any other therapy. It improves circulation, respiratory function, autonomic well being, including the balance between sympathetic and parasympathetic nervous system, and it improves the mental well being. And improving in mental well being improves the physical well being, and in turn, it improves the autonomic nervous system balance. There are many articles on yoga. I would leave the researcher to explore it, to learn more. However, I'm going to give you a 30,000 foot overview of yoga in 5 minutes. This is one of the article from 1972. As you can see, it has been research for a few decades in the West. And again, it explains the scientific basis of yoga as a technology for emotional, mental, and physical well-being. This is from Osteopathic Association, and according to this article, yoga helps in reducing chronic pain, increases flexibility, increases muscle tone and strength, improves respiration, energy, vitality, and improves the metabolism, balance of the metabolism, helps in weight reduction, and helps in cardiopulmonary function, improved athletic performance. And of course, the healing will be better in somebody who are avid practitioners of yoga. And often people who are in good state of mind and body will have a better recovery following injury or surgery. And since yoga gives you a unique technology that helps in physical and mental well-being, this certainly will improve the recovery and shorten the hospitalizations. This article published in 2016, just even 10 weeks of yoga practice improved the flexibility and balance of college athletes and thus improved their athletic performance. And now a lot of athletes do yoga, whether it's cricket players in India or various other players throughout the world are practicing yoga on a regular basis. Certainly, it is not often practiced in a community setting for various reasons. Regarding emotional well-being, it helps to manage stress. And since stress manifests as physical symptoms, which is referred to as psychosomatic illness, often patients complain of pain, and that leads to variety of symptoms, including sleep problems, chest discomfort, GI problems, pain issues, and thus memory issues. And if stress can be managed appropriately, mental clarity improves, calmness happens, and focus improves. And for children and for people who are employed, improvement in focus, calmness, and clarity improves productivity. And thus it improves the psychological problems. So people will be able to sleep better, anxiety and depression is well controlled. Using just pills to control these problems is a fruitless venture. As many physicians have already realized, we keep prescribing these medications and patient comes back saying that it's not helping. Often in these psychiatric conditions, there is much more complexity and you cannot just control these problems with the pills alone. And yoga offers a unique benefit in complementing the medications. And in fact, after a while, they may be able to come off medications completely. This is a Harvard Medical School publication. And as you can see, they have a research publication in 2009 saying that it improves anxiety and depression and thus modulates the stress. Again, you can Google, there are lots of resources on the internet. 7 Ways Yoga Lower Stress and Anxiety by Dr. Gillihan. I'll briefly go over it. Yoga lowers tension and promotes relaxation, helps us regulate the breath, increases bodily awareness, interrupts worry cycles. Doing yoga demonstrates self-compassion, fosters self-acceptance, and trains us to accept discomfort. This is very important. If you can improve any of these qualities, the overall care you provide to the patient will significantly improve. There are lots of poses. Again, yoga is not just a pose. Yoga is a technology. It is a multi-step approach. You need a clean mind to create a focused mind. You need to change your diet, improve your diet to get a fit body. And ultimately, when you have a fit body and focused mind, you will be able to overcome stress much more easily. So yoga is not just alone poses. It is much more than that. It is breath regulation, which is called pranayams, asanas, which is just poses and body stretches, and meditation. Of course, prior to all these things, you need to come up clean in the mind. So you need to have a clean thought process. This is a Berkeley study, and they say that yoga even can be implemented at elementary school, as it has shown to improve not only the grades, but also the overall atmosphere in the school and the well-being of the students. It also improved emotional regulation of children and the fewer behavioral problems, and it improved the classroom climate. These behavioral problems, whether you deal with ADD or autism spectrum disorders, often we try to treat them, especially ADD, with medications. I find it a very fruitless venture. Yoga, meditation, I believe, has a tremendous role here, and we don't need to put these kids through these poisons of drugs. And that certainly, if necessary, you can use it, but yoga and meditation probably can be used as a first line treatment to improve their well-being. Again, this is a statement from Neuropsychology and Educational Services for Children and Adolescents. According to them, yoga is a safe, holistic approach for healthy development in children. Certainly, I agree that this is same statement holds true for adults as well. In summary, I believe yoga is a tremendous technology with a lot of potential to improve the well-being of patients, society, and children. And it can reduce the need for medications. Since yoga is available essentially free, it is a technology you can implement immediately. Certainly, I do not think pharmaceutical companies will market this technology, as there is no incentive for most of the people. But as a person, you really want to explore this. There are many yoga teachers all over the world. You can contact them, get to a certified yoga teacher, or just go to YouTube and learn about it. And most likely you will find amount of information, tremendous amount of information, and you probably don't even need teacher. But before you do any of the asanas or pranayams or meditation, please make sure to consult your personal doctor. Note that this is not a professional medical opinion, but a community education event. Thank you and enjoy. Today is Sunday, May 31st, and this is Frisco, Texas.